Good afternoon, everyone. My name is Maya Luria with TMC for Seniors, and today we're going to be talking about what's ringing in my ears, managing tinnitus. I have Haley Lanoue here with me. She is an audiologist with our outpatient therapy and audiology department, and I welcome you here today. How are you, Haley?
I'm doing well. How are you?
Good. So I know you have an in-person audience along with an audience that is watching from home. I'm going to go ahead and put your PowerPoint up for you so that you can get started. If you have a question for Haley and you're watching from home, please feel free to put those comments into the chat and we will address those afterwards.
All right. Thank you very much, Maya. Like Maya said, my name's Haley Lanoue. I'm one of the audiologists here at TMC. I work with a team of audiologists over at the Atrium doing audiology services, hearing loss, hearing tests. I also do dizziness and balance testing at the Outpatient Therapy Center as well. But I focus on vestibular dizziness evaluations and tinnitus patients primarily. So as we start this talk, this is my disclaimer that this is an informational, educational talk. This is not your specific medical advice. So please, if you're having symptoms, talk to your doctor, talk to your audiologist. A lot of these are like good information and strategies for you, but please seek medical advice. So what is tinnitus? It's why we're all here. Tinnitus is the perception of sound when no external sound is present. So most often you hear it described as a ringing, but it can also be a chirping, buzzing, humming. You can even have musical sounds or you can hear music. That is all considered tinnitus. So it's your brain is making a sound, not something from the outside world. It's very personalized, so no two people are going to explain their tinnitus the exact same. It's what you perceive. It's very personal and individual. There are two main types of tinnitus. So the vast majority of people, and what we'll mainly be talking about today, is the subjective tinnitus. So the tinnitus that you perceive, it's only perceived by you. Then we also have objective tinnitus. That means someone else can hear that sound as well. So maybe you hear your own heartbeat, and if someone gets close enough, they can also hear your own heartbeat. That's one example. That's pretty rare, so we're pretty much going to be talking about the subjective type of tinnitus today. When we talk about tinnitus, we often group it into how long it's lasting for. So chronic tinnitus is considered anything lasting 5 minutes and occurring twice a week. Anything less than that is not chronic tinnitus. And then we also have something called a transient ear noise. Transient ear noise is very common. It's that sensation when all of a sudden you get like a fullness in your ear and a temporary deafness and then a high-pitched ringing or buzzing sound. And then it goes away in about 30 seconds to a minute. It almost is like a temporary, like, oh, something's going on there, and then it goes away really quick. That is called a transient ear noise. Anything else past that is considered tinnitus. Oh, and I forgot to mention tinnitus and tinnitus are both correct pronunciations. I say tinnitus, both are correct. So as an audiologist, when I am talking to you about your tinnitus, I am going to be asking you to describe it for me so I can get information about it. One of the main things I'm going to ask about first is symmetry. Are you hearing it in one ear, both ears, in the center of your head? Is it worse on one side or the other? Because that gives me important information on how to treat you and manage you. Next. Duration. So is it constantly there? Does it come and go? Is it constantly there, but times it gets worse or better? What makes it worse or better? If you notice anything that does. Are there any other associated symptoms with your tinnitus? So does it come on with any dizziness or vertigo, a headache, ear pressure, fullness? Does it come on with facial tingling or numbness? These are all important symptoms that I need information on for knowing, is this something that I will handle audiologically, or if I need to refer you on for medical evaluation. And then quality or characteristics. So what it sounds like can be important, but that's the lowest on my totem pole of what it sounds like to you, because everyone perceives it differently. But I need all of that information, getting a detailed history, what it's associated with, so I know what to do next and how to treat you. Tinnitus is very common. So you are all probably here because either you or someone you know has tinnitus. Estimates are, of the global population, 10 to 30% is the current estimate. It ranges widely across the different studies. It's something that's really hard to get good information on. So this is probably an underestimate of the amount of people with tinnitus. These are people that are reporting tinnitus to their providers, to their doctors. Of those people with tinnitus, so if we go on the low end, 10% of the US population is 25 million Americans. Of those 25 million Americans, about 20 to 25% of them report it as a moderate or very big problem. And then 1 to 3% of those people consider it a debilitating problem. So it very much ranges in intensity. Some people hear it and they're not bothered by it. Some people hear it and it is debilitating and affecting every part of their quality of life. Tinnitus is more common as we age. It's more common with noise exposure, the amount of hearing loss you have. It's more common, and then military and veterans, it's more common. Tinnitus is actually the #1 service-connected disability at this time, which is how common and prevalent it is. Like I said, it's highly individualized. Some people are not bothered by it. Some people, it's affecting everything. It's affecting ability to fall asleep, concentration. It can cause anxiety and distress, depression and social isolation, irritability, frustration. It can affect your mood. It can affect your relationships with everyone around you. Everyone is different and is going to experience these symptoms in any number of ways. Even if it is affecting you in all of those ways, there is help for it. So one thing I want you to take away from today is there are ways to help manage your tinnitus. I know a lot of people here, you'll just get used to it. There's more to that, and there's ways that we can help you along the way with getting used to it and living with it better. So before I get into more of tinnitus, I want to talk about the ear and hearing first. So this is your ear. We have your ear in 3 main parts: your outer, middle, and inner ear. Your outer ear is your ear canal to your eardrum. I'm not sure if this light works or not, but that's what most people think of when we think of our ear. And then we have your middle ear. That is an air-filled chamber. It's 3 little bones in there that help amplify sound into your inner ear. It also connects to your sinuses through your eustachian tube, the little tube going down here. So it equalizes pressure. That's why you get a pressure change when you go up in an airplane or over a mountain pass, because of that little tube opening and closing. And then we have your inner ear. Your inner ear, there's the spiral, which is called your cochlea for hearing. And then we have your vestibular system. We're not going to talk about that today. I talked about that previously if you want to look back. So we have your balance portion, and then we have your hearing portion. Sound goes through the outer ear, the ear canal, vibrates the eardrum. That vibrates the 3 little bones, which sends sound down to the inner ear, the cochlea. From there, that sound vibrates membrane, and then it vibrates these little cells that we call hair cells, and that's what sends the signal to the nerve, to the brain for hearing. So once the ear processes all that sound, it sends signal to your hearing nerve, and that goes through a whole load of different pathways in your brain so that you can not only detect sound, hear sound in the first place, so that you know where it's coming from, so that you know what that sound means to you. Was it a door slam? Was it someone talking to you? And then how you respond. So through your ear is very important for you to hear and detect sound. And then that pathway is how you understand and process sound. It goes through many different portions, through your brainstem, through the center of your brain, through the cortex, to your auditory processing center. And why that's important is because anywhere on that pathway from that outer ear to the auditory cortex, that is where tinnitus can emerge from. So there's many theories of what causes tinnitus exactly, and we don't exactly know yet. There's no definitive answer yet. But one of the strongest theories is there's some kind of damage along that pathway, and then your brain is kind of overcompensating for that damage, and that is what creates the tinnitus or the sound that you hear, the ringing, buzzing. So one common example is if you have hearing loss, which can come from many things, but if you have hearing loss, then your brain is no longer getting input at that area of hearing loss. And so then your brain overcompensates by making cells fire there, even though it's not receiving anything. So you kind of get this phantom noise because your brain is making up information for you to perceive. That's one theory. There's many theories, and there's many parts of that auditory system that can be impaired or correlate or contribute to your tinnitus. So again, it's very individualized. Nobody is the same. So that's the majority. That's what we call neurophysiologic, happening somewhere in the ear or the auditory processing pathway. And then we have somatic sounds. Those are body sounds. It's much more rare. It's like hearing your own heartbeat, or a few people can even hear their eyes move, things like that. If you do hear those, I recommend going to see an ear, nose, and throat doctor. I'll get to that in a bit. But we're going to focus on the neurophysiologic aspect today. One important aspect I always like to review is that tinnitus is a symptom, and tinnitus does not cause hearing loss. People with hearing loss often have tinnitus as a result of that hearing loss and that damage from the auditory system, but the tinnitus itself is a symptom. It is not causing the hearing loss itself. So what causes tinnitus? Again, anything that can impact that auditory processing pathway, but there's over 200 known associated events or risk factors for tinnitus. Basically anything can cause tinnitus, essentially. There is a correlation in the more hearing loss you have, the more likely you are to have tinnitus. But the more hearing loss you have does not mean it's going to be more severe. So the more hearing loss you have a higher likelihood of having tinnitus. But even if you have a profound hearing loss, you might not have any tinnitus, or it might not be bothersome to you. And if you don't have hearing loss, or you have a very mild hearing loss, you could have very bothersome and severe tinnitus. So hearing loss can result in tinnitus, but it doesn't necessarily result in how you perceive that tinnitus. So one of the strongest risk factors for tinnitus, one of the biggest correlating events, is noise exposure. And that is because noise exposure leads to irreversible damage to the inner ear structures, and that can lead to tinnitus. And it's one of our best ways to modify anything with tinnitus. So protecting your ears from noise exposure is very important. Noise exposure is additive over our lifetime. So even noise you heard back as a teenager can still be affecting how your ears work and handle noise in the future. The more loud noise you hear, the more likely you are to damage your ears. So I highly encourage hearing protection in any event with loud noise. What is loud noise? In the handouts, there's these charts for you. Basically anything above a hair dryer that you're going to be using for minutes at a time, the louder the noise is, the less time you can be around it without it damaging your ears. So anything like power tools, even just a hand drill, lawn mowers, you should be wearing hearing protection for. And then anything louder than that, you definitely should be wearing hearing protection for. There's many types of hearing protection. The most important part of hearing protection is that you wear it correctly. So if you have the foam earplugs, roll them up really small, pull your ear back and make sure it's all the way inserted, and then you give it time to expand again, and you notice a difference in how you're hearing. If it's not seated properly, if it's sticking all the way out here, if you don't notice a difference and you're hearing less sound with it, then they're not working properly and you're not protected against the noise. If you're wearing ones that go over your ear, make sure they're fully seated and sealed around your ear. If they're kind of off, you're not protected from that noise. So the most important part of hearing protection is wearing it correctly. So concerts, lawn mowing, power tools, chainsaws, working on engines, all of that you should be wearing hearing protection for. Other risk factors, in no particular order, head injuries, concussion, TBI, highly linked to anxiety and depression, increased stress, sleeping problems, more likely to have tinnitus, cardiovascular disease, thyroid disease, the older you are, whole bunch of different risk factors there. I am going to save questions for the end if that's okay. So we have risk factors that might lead to a greater chance of having tinnitus, but then we also have exacerbating factors. So things that might make your tinnitus worse. So things that might make your tinnitus worse are more loud noise exposure. A lot of people experience the sensation of you go to a concert and then you leave and everything sounds muffled and your ears are ringing really loud for hours or a day or so, and then it returns to normal. Hopefully you're using hearing protection and that doesn't happen, but many people do have that. So loud noise exposure can lead to increased tinnitus. Stress and anxiety can lead to an increase in tinnitus as well. Lack of sleep, if there's something going on like an earwax blockage or an ear infection, sinus infection, and then caffeine, alcohol, nicotine, marijuana, certain medications can all increase how loud and bothersome that tinnitus is as well. And again, that's going to be different for everybody. Why this is because of what we call the negative feedback loop. Once you hear that tinnitus is there, our brains really like information and they like paying attention to things. So once your brain hears it, it's going to pay attention to it. And then once you pay attention to it, you can get a negative emotional reaction. You might not recognize it as a negative reaction, but you have a reaction where that tinnitus is bothersome to you. And then when it's bothersome, it can increase in how loud it is. And when it increases how loud it is, it increases how bothersome it is. And things like anxiety, poor sleep can all affect that as well. And it makes it even more bothersome. It increases that negative feedback loop. So if you're going through a stressful life event and you're not sleeping as well, and then you get up and you have 3 extra cups of coffee in the morning to compensate, those could all be contributing to your tinnitus being louder for you. So how we manage it is, our goal is management of tinnitus, feeling less stressed about the tinnitus, not having a negative reaction to it anymore, being able to hear it and it be just there, neutral or not having an impact on your life. You can hear it, you can put it in the back of your head, you can forget about it, you can do your daily life without it affecting you or interrupting all of the things that you do. And why we focus on management rather than a cure is, one, because there's so many possible causes of tinnitus and we don't know all of them. It's really hard for us to research and find a cure for everyone. And if we ever do find, quote unquote, a cure, it's not going to be a one-size-fits-all for everybody. but currently there's no medication or supplement on the market that can cure tinnitus. Anything marketed for it, it is as effective as a placebo effect, and some of those supplements can also have other side effects that might not be good for you, and you should always talk to a doctor before adding a supplement in. But currently, the American Academy of Otolaryngology and Head and Neck Surgery recommends against using any supplements or medications as a quote-unquote cure for tinnitus. There are some medications if you're experiencing stress or anxiety that might help with that, and managing those conditions can help reduce how bothersome tinnitus is, but there's no medication for tinnitus specifically. However, that being said, don't lose hope because of that, because we have a ton of research showing that management of tinnitus is significantly beneficial and very much increases your overall quality of life. So that's why we focus on the management, because we know the management works. The cure, the medications, leave them aside. Let's focus on the management. So you have tinnitus. Who should you see for starting that process? If you have any unexplained sudden loss of hearing, you wake up and you can't hear out of an ear, or you are going about your day and suddenly you can't hear anything and there's a lot of ringing or buzzing, you have sudden onset, severe vertigo, any kind of facial paralysis, something like that, you should seek emergency care. Make sure it's not something like a more serious medical event going on. Also, a sudden unexplained hearing loss, that should be treated as quick as possible. The sooner you get treatment, the more likely you are to have success with that treatment. So if you have a sudden hearing loss, please seek emergency care. If you have pulsatile tinnitus, so hearing your own heartbeat, or if you can hear your own body sound suddenly, or if you have any pain or drainage or signs of infection, or the tinnitus is very severe and sudden, or if you have vertigo, spinning, dizziness, you should see an ear, nose, and throat physician. That's the medical doctor who's going to evaluate you medically to see what's causing that so that they can treat you medically as well. Anyone else can see an audiologist. So that's anyone who has like a gradual onset of tinnitus. There's none of the above signs. It's pretty symmetric between your ears, or no other sign of infection. The majority of patients have this. It just kind of starts one day and gradually starts to get worse over time. Those are the people who I would recommend to see an audiologist, or anyone with tinnitus who hasn't been evaluated yet. I would recommend to see an audiologist. What an audiologist is going to do is we're going to do a hearing test, because again, hearing loss is a predictor of tinnitus. So we want to know if you have hearing loss. And then we are going to check for ear infections or any other signs that you should see an ear, nose, and throat doctor or further medical evaluation. We're going to review your history of your tinnitus, of your auditory history. If there's any other red flags that we see, we're going to do that hearing test. We're going to check how that outer ear, middle ear, and inner ear is all working. And then we are also going to start the process of counseling on your tinnitus, what it might be from, how to manage your hearing loss, kind of tell you what the next step should be. And so those next steps, again, is focused on the management of tinnitus. So one of the best things that we can do for our tinnitus is education, like attending this lecture right now. There's also different types of sound therapy, and there's multiple different evidence-based approaches that we can take. Different audiologists work with different approaches. So if you don't find what you're looking for in one audiologist, you might work with another audiologist who has a different type of approach. One approach is progressive tinnitus management. That's the one I typically work with. It stems from the VA. The NCRAR is the National Center for Rehabilitative Auditory Research at the VA in Portland. they have a ton of research and data and a whole program set up called Progressive Tinnitus Management that I, as an audiologist, will work with you through. Or you can also seek those resources on your own. They are available for the public online, and I have the resources linked at the end. Most of them all center around counseling and education. Some type of sound therapy is often used, habituation and reduction of negative reactions. So habituation means you get used to what's going on. So kind of like you put a hat on, at first your brain says, okay, I know the hat is there, but as you wear it throughout the day, you start to forget that it's there. That's one example of habituation. And then also working with you as the patient to find what works for you. No individual person with tinnitus is going to be the exact same as the next person with tinnitus. So again, habituation, our brain is designed to pay attention to new information. So when that tinnitus is there, our brain is going to pay attention to it because it likes to pay attention to things. And so what we're going to try and do is to say, okay, brain, I know they're ringing, that tinnitus is here, but I can forget about you now. Kind of like you can hear the refrigerator running all the time, and eventually you don't notice it anymore. The sound is still there, but you're not paying attention to it 100%, 75% of the day. It's just in the background for you. And that is one of our big goals for tinnitus management. How we do that, one of the best strategies and one of the common pieces of this throughout all of those different types is something we call a sound enriched environment. That is a fancy term for background noise. So what we can do is we can put another type of sound in your environment that's just, again, kind of in the background, not super noticeable. We don't want to be paying attention to that completely, but something else there can help our tinnitus go from here, very noticeable, to less noticeable. So we go from a quiet with our tinnitus is up here to we have this other sound in, and now this isn't as noticeable of a difference, and our brain can kind of put this in the background as well. It reduces that contrast, and it also starts the process of breaking up that negative feedback loop. So our brain, instead of saying the tinnitus is here, it's bothersome, so it's going to get louder and become more bothersome, we bring in some background noise and it breaks up that cycle so it's not just continuously getting louder. I like to think of this like looking at a candle in a dark room. So if that candle is your tinnitus and it's sitting on a table in a dark room, the only thing you are going to see and pay attention to is that candle. It's going to be very prominent and present in your vision. It's the only thing your brain is paying attention to. But if you turn on the lights and that candle is sitting on a table with a whole bunch of other stuff going on, it's not very noticeable anymore. It's still there, but your brain is able to forget about it. It's focusing on something else. So each person is going to vary in how you use a sound-enriched environment or a type of background noise. An audiologist that specializes in tinnitus management can help walk you through this process, but you can also start this process on your own at home as well. I like to break sounds up, and so does Progressive Tinnitus Management, into 3 sounds. We have background, soothing, and interesting sounds. Background sounds is something that's neutral and easy to ignore. So think a fan turned on, or wind noise, or white noise, or like elevator music. Something that is there, but it's easy to forget about. You don't want it to be very noticeable so that you're not just paying attention to that anymore. You want to still go about your day and do all of your other tasks, talk to people, do your work, read your books, etc. But it's just something that's there. It's neutral, easy to listen to. It's not louder than your tinnitus. It's either just at your tinnitus or below your tinnitus level, and you turn it on and it just helps kind of relieve it a little bit. Soothing sound, kind of the same idea, but something that when you listen to it, you have a calming or positive emotional response to it. So think like spa music, or I really like a stream sound noise when I sleep at night. Meditation, relaxation music, or maybe it's instrumental music or something that you know and you like to listen to, and it's not new information, but it's something that's calming and soothing, and again, easy to forget about. And then interesting sound is anything that does actively take your attention away. So watching TV, a movie, listening to an audiobook, radio, new music, going outside, listening to nature sounds, talking to a loved one. It should be something that you enjoy. So don't talk to someone that you're stressed out about or having a disagreement with, but calling up a friend or loved one or family member that you enjoy talking to, and it's going to be stress relieving for you. I think that's one of my favorite things, or finding an activity you enjoy doing that is going to take all of your tension away. When to use these different types of sounds. So background sound can be used anytime, anywhere. One of the biggest, or one of the most common ways is to like turn a fan on, or have like sit next to your refrigerator or something like that. Something easy, it's in the background, it's not bothersome. And that's just your daily life, going through your daily tasks. If you're working, you can use it at any time. Soothing sounds, I like to recommend, you can also use it at any time, but especially when you're falling asleep at night. Oftentimes, people find it hard to fall asleep at night with tinnitus because it's so quiet. There's nothing else to listen to. It's the time of the day where you're trying to unwind and relax. There's nothing else going on. So then your brain latches on to that tinnitus because it likes to be paying attention to something. So having something soothing can really help you fall asleep at night. It gives your brain something else to listen to. It has that calming emotional response as well, which can also help with sleep. And then interesting sound or an activity is when that tinnitus is really severe. You can't get away from it. It is so intense. It is the only thing you can think of. The soothing sound isn't helping. It's so intense you can't fall asleep. Then get up and do something interesting. Listen to that interesting sound until it calms down to really take yourself out of that space. If it's so severe and you're just sitting in quiet or just sitting listening to a white noise and it's just getting more and more intense, it's going to just keep getting more and more intense. So take yourself physically out of that space, put something on, do an activity that you like to do to help break up that cycle. Where can you find these sounds? Anywhere. Use your imagination. Fans, television, radio. A lot of people have smartphones now, and a lot of those smartphones have YouTube music or some kind of streaming where you can find music. Your record player. There are CDs meant specifically for tinnitus that you can purchase probably online still. There are also, at the end of this, I have a website linked for tinnitus specific sounds as well. You can go to that website and just have them play on loop from there. Use anything that you like. Again, it should be something that you like. If you're annoyed by it, don't use it. It's going to make the tinnitus worse. There's a lot of apps. So refer back to this app list. I believe all of these that I listed are free. Some of these apps are hearing aid, like from hearing aid manufacturers. But any app that's designed for relaxation, meditation, sleep, or any kind of white noise sound, anything like that, don't buy anything. There's so many good free options, so don't buy anything. But there's a lot of apps out there on the smartphones as well. If you have a radio, you can just set it in between channels and play the static noise if you like that. If you have an iPhone, I haven't seen anything like this with Androids yet, but iPhone, iOS 15 or newer, you can actually get them on what's called your control center, so you can just play them anytime from your like home screen, which is really nice, and they have some good options. And there's the instructions there for you to set that up if you want. How you listen, anything that plays sound. So it could be your phone if you're using that. It could be any type of headphone. There are tinnitus specific sound machines out there, or you can even, for a cheaper option, order like a baby sound machine on Amazon. Those are often cheaper than the tinnitus ones, and it's the same thing. It's white noise, it's rainstorm noise, something like that. It is nice to have more options than just one option that you like. So getting something with several options that you might like would be important. Maybe playing those sounds on like YouTube or something first so that you know what they sound like and if you like them or not before you go and purchase a device. Headphone considerations are definitely good, and you can use them so that other people aren't hearing the sounds as well. But standard headphones, you're not going to hear the environment anymore. So if you're working and you need to be in a meeting or something like that, a typical set of earphones is not going to be the right thing for you. I have other options in a second. But there are open ear headphones. So one common type is bone conduction headphones. It's the second photo down. And they sit just in front of your ears, and they actually play just to the bone, the cochlea in your inner ear. So you still hear all of your environment noise, but then you also can hear music as well. They are a little pricey, but that's one option. Any kind of headphone that has ambient sound technology so that you can still hear the world around you if that's something that you need. When you're going to sleep, if the person you sleep next to doesn't like to hear those sounds, you can get speakers for around like $12, I think, on Amazon that plug into your phone or whatever device you're playing from, and then they just sit underneath your pillow, so only you can hear it. Or you can get like a soft headband to play as well, to Bluetooth to your phone or hard wire into your phone as well. So those are options if the other person in the room doesn't like to hear the sound that you like to hear, or if you like different sounds. And then the last one is on-ear tinnitus sound generators. They essentially are a hearing aid that we program to just play those sounds in your ears. The really nice thing about this is that you can hear all of your surroundings. They aren't earphones, so you're not ignoring everyone around you. You can wear them while you work. You can wear them while you're out to dinner. You can wear them all the time, and you can hear those sounds that help with tinnitus while not impeding any of your other world that you're trying to experience. Yeah, I just said all of that. They're typically not worn at night though, so I always recommend having something else to play at night so that your ear canals can breathe. There is the phenomenon that if you do get tinnitus sound generators, oftentimes people notice that when you first take them off at the end of the day, your tinnitus tends to be more noticeable. And that's because your brain went from not really paying attention to it to, oh, there's no more sound in the environment. Now I'm really going to pay attention to this. So I recommend having something on in your environment. If you do have something on your ear like hearing aids or sound generators, play something from the environment like a TV show or one of those sounds we just talked about. Play it a little bit louder as you take those off so that that transition period is a little smoother. But that is a very nice option. However, that can be a very expensive option, which is why I gave you all of those other options as well. And then hearing aids. So if you have hearing loss, the first step to treating your tinnitus is to treat the hearing loss. And that is because it's automatically going to give you ambient sound because you haven't been hearing that sound, so it's amplifying it for you. And then you get all of the environmental noise, your clothes moving, your footsteps as you walk, the cat running across the floor. And that sound in and of itself can significantly reduce how bothersome the tinnitus is. But we can also add those extra sounds like white noise, stream noise, something else like that into the hearing aids as well to play as you're also getting more information from your environment and treating the hearing loss. So we always recommend hearing aids first if you have any type of hearing loss. Hearing aids come in all shapes and sizes. put a lot of photos there for you. They aren't giant usually like they were 15, 20 years ago. So if you haven't gone and gotten a hearing test or talked about hearing aids yet, I would recommend going to get a hearing test, seeing if you have hearing loss, and treating that hearing loss first. Other strategies, we've kind of already talked about a lot of these, but prioritizing things you enjoy, anything that you can do to help your stress management or anxiety symptoms or sleep symptoms can really help to improve how bothersome that tinnitus is. So anything that you can do to improve your quality of life is likely to help improve how bothersome the tinnitus is as well. Doing things you enjoy, mindfulness and meditation can be a very powerful tool as well. And there's many studies that show that using mindfulness and meditation can help reduce how bothersome that tinnitus is. It's kind of like saying, okay, I hear you, tinnitus, and I can ignore you now. Support groups can be a double-edged sword, or like online chat rooms and things like that, because the more you think about and pay attention to your tinnitus, the louder and more bothersome it's going to get. So it can be really helpful to know that there are people out there with tinnitus also struggling with this, but it can also lead to thinking about it too much and getting too fixated on it, and then it getting worse because you're thinking about it all of the time. So take those with a grain of salt. Know that you aren't alone. Sometimes it is nice to have those support groups so that you know you're not alone, but know that if it seems to be getting worse with those support groups, it might be time to take a step back from them as well. And then everyone is going to be different. So people are very creative when they come to me and they say all sorts of things can help their tinnitus. And if it's helping your tinnitus, keep doing it so long as it's not causing you harm, so long as you're not playing your music all the way up all the time or something like that. But find out what works best for you. Not everything is going to work for everybody. I personally hate the sound of fan noise. It makes me really annoyed, but other people love it, and that really works for them. So it's going to be different for every single person. And then other strategies are meet with an audiologist and discuss it with them. You can see me, or you can see Audiology at TMC, so I put our information there. We do require a referral from a physician to be able to see you. I know your insurance usually doesn't require a referral, but TMC does, so you'll need a referral to be seen at TMC. And then we'll do the hearing test, we'll talk about your tinnitus, we'll do questionnaires to track how your tinnitus is progressing, and we'll come up with a plan together. And then at the end, I put several different resources for you. These are really great places if you're going to be looking online for more information. And then the Progressive Tinnitus Management one has a lot of they have a whole workbook you can use, and they have different sounds online as well. And just if you're going to be Googling, I recommend starting here. And that is it from me. So we have a bit of time left, I think.
So, Haley, thank you. I'm going to go ahead. I have a couple of questions that actually came in. So thanks. You really gave a great overview and great suggestions, I think, for folks. Are there any age-specific related factors that can make managing tinnitus more challenging as we age?
Are there any age-related factors that make tinnitus more challenging as we age?
Specific ones, and the only thing I could come up with is maybe like some of the technology could maybe be a barrier, right?
The technology can be a barrier, but like I said, we can get creative and use things like just a radio or your record player and things like that. I think the biggest barrier is not scheduling to see an audiologist to get your hearing tested. is very common as we age. People delay getting a hearing test from the time they first start noticing tinnitus or hearing loss up to 8 to 10 years often. So the earlier you can get tested, the earlier we can start this process. I would say that's the biggest age-related factor.
Okay. And are there, can healthcare providers differentiate between tinnitus as a standalone condition and tinnitus as a symptom of a more serious underlying issue?
Can healthcare providers differentiate tinnitus as a standalone issue or a symptom of a more serious issue? There are definitely ones that they are looking out for, and your primary care knows which ones are serious red flags to send you to an ENT or the emergency room or something like that. And then just if you're worried about it, I would talk to your primary care doctor and they can refer you on to audiology, or if they think you need to see someone more specialized than that. And then an audiologist can do the same as well. So yes, they know the big red flags to look for.
And what is the recommended way and perhaps tool to clean your ears to reduce any kind of earwax blockage?
How to clean your ears to reduce earwax blockage. Please do not use Q-tips. I would recommend just getting your ears checked by your primary care provider to see if you actually have an earwax blockage. Everyone has some kind of earwax. Well, not everyone, but it kind of sloughs out on its own, and then you can use just a tissue after you shower, wipe it out at the edge there. But I don't really recommend cleaning your ears with anything unless you talk to a doctor about it. The safest method for at-home cleaning would be using earwax softening drops and rinsing with water, but only if you don't have a history of ear infections or burst eardrums or anything like that. But I would just see your primary care doctor or an audiologist to check your ears out before cleaning.
Okay. Can you also, can you explain to us what, I've got somebody who said they've heard you before about tinnitus. They want to know about the, I want to make sure I'm pronouncing this right. Is it pulsatile tinnitus?
Pulsatile tinnitus. So pulsatile tinnitus just means that it's pulsing. It's going like boom, boom, boom. Oftentimes, if you're hearing pulsatile tinnitus, you're usually like hearing your heartbeat a little bit. And that is one thing I would say to see an ear, nose, and throat doctor about, because there are certain things, just like high blood pressure can increase the chance of that, but there are more serious conditions that can cause that as well. So.
Okay, great. Now, explain to us, what does a typical appointment look like with you for audiology therapy?
So what does a typical appointment look like? You would come in, I would ask you all of your history questions. I'm going to look in your ear, make sure it's not earwax or what we do about that. I'm going to do a pressure test in your ear to make sure your eardrum is moving well. You're going to be in a sound booth. I'm going to put some headphones on you. I'll make you listen for words and beeps, and then more words and then more beeps. You'll be annoyed of all the beeps at the end. And then we'll talk about your results and next steps. And then typically from there, we schedule another appointment to talk specifically about more of the tinnitus. I'll do kind of the basics of tinnitus at the first appointment, and then we schedule a follow-up to go more in depth about the tinnitus.
Okay. And so you're required to get a referral, is that correct? To come to the...
We require a referral.
Okay. So, and that can be from any of their physicians, I'm assuming?
Any physician.
Okay. Okay. And can you share, where do they call, and what would and where are you located?
Yes, so we are located at the Atrium building. So that is on the northwest corner of Grant and Rosemont, so just west of the TMC hospital. And then to call, you can call if you have a referral, you can call the central scheduling line, or if you're having any difficulty with that process, you can call our front office at 520-324-1055, and they'll help get you on the right track. for where you need to contact. Okay.
Great, thank you. I'm going to wrap up with our online audience. Thank you so much for being here today. I'll send it over to you to answer any questions in person. Thanks, Haley.
Thank you.
Thanks again for being here. We look forward to seeing you again after the holidays. We hope everyone has a great Thanksgiving. Our next calendar will be coming out at the end of December, probably that last week in December. So look for that. If you have any questions, you can always give us a call in the office. The phone number is 520-324-1960. Have a great afternoon. Thank you.